Hello guys, this is a clinical video of isolation of mandibular first molar. As you know, there are different ways of isolating a tooth for endo treatment, and I want to show you one of the easiest ways. In this technique, you place the clamp first and then place rubber dam and frame together. I always place a cotton roll in the patient's vestibule before clamp placement, and it helps retraction of the lips and cheek, and you have a better visibility of the tooth. Next step is clamp selection, which I will explain in another video. I usually prefer wingless clamps in this technique, and there is no rubber dam sheet, so we can easily see bigs of the clamp. We can retract patient's tongue using mirror, and we check the position of the clamp placement both in buccal and lingual. It's very important to check the clamp for rocking both in buccolingually and especially anterior posterior aspect. The clamp should be stable, and as we place rubber dam in a posterior to anterior direction, there is a force which enters from posterior to anterior and can lead to movement of the clamp, so it should be stable. Next step is placement of rubber dam and frame together on the tooth. We can mark the location of the tooth on rubber sheet and make a punch hole in a good location, and we can also use templates for making holes. We should choose the biggest hole for the punch, biggest hole of the punch for the tooth with clamp on it. Try to make a hole in one movement to have the sharp edges of the hole, and by guiding the fingers of both hands, the rubber dam passes over the clamp from distal side and is completely in place. In some points, the rubber dam may be far from the clamp and tooth, and we have to guide it with an instrument or fingers so that it is in the right place. Then we should check for any leakage. As you see in this case, the gingiva is visible in buccal side and isolation is not complete. So we should replace the clamp. As you can see, while the buccal side of the clamp is in contact with the tooth, we elevate the lingual side so that the rubber goes under the beak of the clamp and completely stick to the tooth. And then we should keep lingual side in contact with the tooth and elevate buccal side. Now we have better isolation in buccal and lingual sides, but we may have leakage in mesial and distal sides, and rubber is not past the interproximal contact. We can guide rubber dam between contacts. It's very important, especially in distal, and you can do it using a dental floss. And when you pass the dental floss, you can see that the rubber passes the contact of teeth, and you can remove the dental floss from one side. At the end, we have a good isolation in all sides of the tooth, and I wish you enjoyed this video and use this technique for isolating teeth.